Peace be upon you, everyone. In the name of Allah, the most gracious, the most merciful. Welcome to the Nursing Mentor channel. In the third episode in the emergency series. In the previous episode, we talked about how to read ABG and the normal values of pH, PaCO2, and HCO3. Today, we will talk about respiratory acidosis versus respiratory alkalosis. Our main reference is the Fast Facts for ER Nurses book. The first section is on respiratory acidosis. It happens because of inadequate ventilation. Carbon dioxide can't get out of the lungs and oxygen can't get in, causing carbon dioxide to increase in the blood, resulting in acidosis as we discussed in the last episode. This occurs due to the mix of carbon dioxide with water forming carbonic acid. To make it easy and simple, just remember carbon dioxide is more inside the lung. So in respiratory acidosis, pH is below the normal value 7.35 and PaCO2 above normal value 45. Causes of respiratory acidosis. It can happen because of pathological conditions that damage the respiratory centers or decrease the ability of the lungs to eliminate carbonic dioxide, CO2. For instance, head trauma, chest trauma, upper airway obstruction, pulmonary edema, pneumonia, COPD, hypoventilation. Signs and symptoms of respiratory acidosis. Number 1. Muscle weakness and paralysis due to decreased oxygenation affecting the muscles and nervous system. Number 2. Confusion, headache. Number 3. Rapid breathing initially as a trial to eliminate carbonic dioxide, but if acidosis become more severe, breathing may become bradypnea. Number 4. Tachycardia, arrhythmias. Number 5. In severe cases, coma and respiratory arrest are expected. Interventions to treat respiratory acidosis. Number 1. Assess respiratory rate and oxygen saturation. Number 2. Administer oxygen and nebulized breathing treatments to enhance ventilation. Number 3. Treat the underlying causes with bronchodilators, antibiotics, or other medications as prescribed. Number 4. Position the patient upright or in a semi-fowler position to help him breathing well. Number 5. In severe cases, prepare for intubation and mechanical ventilation. Now that we know the causes, signs and symptoms, and interventions for respiratory acidosis, let's move to the second section, which discusses respiratory alkalosis in the same steps. Respiratory alkalosis. This occurs due to hyperventilation. In this condition, the person breathes out or exhales all of their carbon dioxide, resulting in low levels of PaCO2 and a high level of pH. To make it easy, in this condition, carbon dioxide is very low inside the body. So, in this case, pH is above normal range of 7.45 and PaCO2 is below the normal range of 35. Causes of respiratory alkalosis. It can also occur due to pathological conditions that damage the respiratory centers or decrease the ability of the lung to retain or keep carbon dioxide, CO2. For instance, hyperventilation, overbreathing, pulmonary embolism or asthma, high altitude such as in mountains due to overbreathing and low oxygen levels. Hypoxia, pain, anxiety, stress, and fever can cause overbreathing. Signs and symptoms of respiratory alkalosis. Dizziness and altered mental status. Hyperventilation, rapid shallow breathing. Palpitations, tachycardia, and chest pain. Alkalosis reduces calcium in the blood, resulting in tetany, seizures, muscle twitching or cramps. Lightheadedness and anxiety. Interventions to treat respiratory alkalosis. Number 1. Assess respiratory rate and oxygen saturation. Encourage patients to take slow and deep breathing to retain CO2 in the body. Number 2. Treat underlying causes, for instance, antibiotics for fever, bronchodilators for pulmonary conditions. Number 3. The most common and important point. To correct hyperventilation, Help the patient breathe into a paper bag or attach a non-rebreathing mask without starting oxygen flow to increase carbon dioxide levels. Now we have reached the end of our episode. It is very simple. If you follow this format, you will remember how to differentiate between respiratory acidosis and respiratory alkalosis. Try to watch it again and take notes. This will help you during work or exams. Don't forget to subscribe to my channel for more updates. This was Mahmoud Shalabi, a nursing specialist, and I will see you in the next episode.